The top stories tonight in Wine News. Government and health officials say the Philippines has not yet lost its battle against COVID-19 despite the surge in cases and near critical hospital capacity, especially in Metro Manila.
Contact tracing czar revealed some local government units deliberately slow down contact tracing efforts to keep cases reports low.
Malacanang reiterates that food delivery should remain unhampered 24/7, especially in areas under enhanced community quarantine. Singapore researchers develop new rapid tests that could detect COVID-19 variants.
Marine scientists say the ocean could be the source of treatment for some of the world's worst diseases, including COVID-19.
And know why Japan's famous cherry blossoms bloomed so early. Good evening, Philippines and the world. Today is Wednesday, March 31, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am Kat Dumaraos.
First in the news. Two government health officials denied that the Philippines' health system is collapsing. This is despite some hospitals in Metro Manila are reaching their surge capacity, prompting referrals to COVID-19 patients in hospitals outside the Greater Manila area. Rosalie Cons explains why.
The COVID-19 surge in the Philippines is very worrying and very alarming, says Treatment SAR and Health Undersecretary Leopoldo Vega. The intensive care units or ICU beds for COVID-19 patients in Makati, Quezon City, Taguig and Navotas are all in a high critical situation. Despite this, the official says the health system of the country is not collapsing. This is in response to the recent claim of the Philippines Hospital Association that hospitals are already overrun and overwhelmed with COVID-19 patients.
Hindi naman talaga tayo talo. The health system is not collapsing. It's just that we are trying to manage the challenge of the surge.
The official added beds in hospitals are being reallocated to accommodate more COVID-19 patients, and health workers from provinces with low COVID-19 cases are deployed to NCR Plus bubble. National Task Force Against COVID-19 Special Advisor Dr. Ted Herbosa shared the same sentiment. He also said hospitals have yet to close down due to the COVID-19 crisis.
Hindi naman, kasi gumagana pa ang mga ospital. When you say collapse, ang tawag namin dyan sa disaster medicine ay yung functional collapse. Hindi na magamot ang mga tao, hindi na namamatay na yung hindi dapat mamatay. So as of now, ang nangyayari po ay we are at the period of what is called a surge capacity. So over capacity yung ating health system, no?
Meanwhile, both officials have agreed to extend the implementation of the Enhanced Community Quarantine or ECQ if the COVID-19 situation in the NCR Plus bubble becomes worse.
As long as may mga pasyenteng positive na naghihingalo, hindi maipasok sa ospital, may problema pa tayo. We need to adjust, we need to stay back, no? Step back and provide options para ma-increase yung surge or mabawasan yung transmission.
Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Department of Health says that the Philippines has not yet lost its battle against COVID-19 despite the surge in cases and near critical hospital capacity, especially in Metro Manila. Aiko Miguel will tell us why.
The Department of Health is confident that the country is still fighting and is doing everything in response to the more challenging situation brought by the COVID-19 pandemic. According to Undersecretary Maria Rosario Vergere, the government is not giving up despite the situation.
Huwag naman po natin sabihing natalo na tayo, paano na po yung mga kababayan nating umaasa sa atin. Patuloy pa rin po ang trabaho ng gobyerno at ng kagawaran ng kalusugan para patuloy po natin maibigay ang mga pangangailangang medikal at pangkalusugan ng ating mga kababayan. Tutuloy-tuloy po natin itong pagbibigay at pag-respond dito sa sitwasyon na ito, and we will ensure na protected po yung public health.
The DOH is calling everyone to cooperate and help each other rather than be divided. The DOH believes that the country can cope up again, just like what happened last year where medical frontliners are asking for a timeout.
Sana po ang ating mga ospital, both public and private, ang ating po mga ibang sektor ay tulong-tulong tayo dito sa laban na to. Gawa na po natin ito dati noong July and August. Kaya po natin gawin ito uli ngayon basta magtulungan tayong lahat.
The DOH explains that there are many factors to consider whether a country has a good response on the pandemic. Based on the country's data, although there is a prominent increase of cases, the case fatality rate in the country is below 2%. This is still lower compared to the global case fatality rate, which is at 2.2%. People should also understand that countries, especially rich, middle income to poor countries, have different health system capacity.
Would still depend on the health system that you have and the capacity of your government. So, yun po mga comparison na to, maganda po iyan at maari po natin mapulutan ng mga leksyon dahil sa mga ginagawa ng ibang bansa. Pero kailangan pagtuunan po natin ng pansin kung ano po ang nagagawa natin namang mabuti dito sa ating bansa.
The DOH admits there are still challenges when it comes to the country's COVID-19 response.
We are not saying we're perfect. We're not saying that we are excellent dito sa ginawa natin na response natin na ito. Pero as long as we can keep our cases for deaths low, as long as that we can still manage the severe cases in our hospitals, at iyan po ang pinakabatayan natin para masabi po na kayang-kaya po natin at kaya natin makaalpas dito sa obstacle or dito sa pagtaas ng kaso na meron tayo sa ngayon, this period of time.
The DOH believes that the extension of the enhanced community quarantine can help the healthcare system breathe. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the country reported its lowest number of new COVID-19 cases in 8 days at 6,128. But the Department of Health said the count does not yet include data from several testing laboratories. The new cases brought the total number of active cases nationwide to 130,245. Of this figure, 95.8% have mild symptoms, 2.6% were asymptomatic, 0.6% were in critical condition, 0.6% were severe, and 0.38% have moderate symptoms. It was shown in the latest case bulletin that the overall tally of confirmed cases in the Philippines is currently at 747,288. The DOH said that 80.8% of the overall tally, or 603,746 people who tested positive for COVID-19, have already recovered. 491 more people were able to beat the viral illness. However, the death count increased by 106 to 13,297. The country's case fatality rate was at 1.78%. The country's contact tracing efforts have slowed down in the recent months, prompting the government to train more contact tracers. Ray Pelayo explains why.
Tracing czar and Baguio City Mayor Benjamin Magalong detailed the status of government's contact tracing effort in an inquiry in the House of Representatives. The official admits that it is frustrating on his part that other local government units do not comply with the standard of contact tracing. Data shared by Magalong showed that ratio of contact tracing efficiency nationwide went down from an average of 1:7 early this year to 1:3 this month.
Kung ang mga local government units nakafocus lang dun sa kanilang 1:4, in short, household lang, after that, wala nang gagawin. Yung ating mga contact tracer, they won't go beyond the first generation. Then ibig sabihin, marami tayong hindi pa nako-contact trace, marami pang close contacts that are roaming around potentially infecting other people, and the local government unit do not know anything about it.
Aside from these budget constraints, cut down the number of contact tracers in the country.
Dati 50,000 tayo. Ngayon dahil because of budgetary constraint, bumagsak na lang 70% out, 30% na lang. That reflects 15,000 na lang na contact tracers. So na-overwhelm ang ating mga contact tracers.
Magalong revealed that some LGUs deliberately slowed down the contact tracing efforts to keep their reported cases low.
So ang gagawin nila, mag-uusap sila ng local health officer nila, magsasabihin nila medyo easy tayo ng konti sa testing at sa contact tracing. So with low contact tracing, low testing, then low cases ka. Ulat ka na lang na after 1 week, bababa ka agad ng cases mo. That is impossible, no?
The national government is currently conducting training for contact tracers within the NCR plus bubble as well as regions 7 and 5. The DOLE earlier said that they will allow hiring of contact tracers using their budget for emergency employment program. Ray Pelayo, UNTV News and Rescue, we serve the people, we give glory to God.
As the government plans to boost its contact tracing efforts, the Department of Health clarifies the guidelines for the use of rapid antigen test. Aiko Miguel explains why.
The World Health Organization has given recommendation on the use of rapid antigen tests as COVID-19 testing in the country. Based on the Department of Health statement, this can be used in the National Capital Region plus bubble. This can be used to people with high viral load or those manifesting symptoms or are sick. Antigen tests can also be used to those who are exposed to COVID-19 patients and who are second or third generation close contacts of those who tested positive of COVID-19.
Hindi pa rin po natin pwede gamitin ang antigen test doon sa mga screening na ginagawa natin, katulad niyang pupunta kayo sa isang establishment, pupunta kayo sa trabaho.
The DOH plans to use it on house-to-house testing in communities with high number of COVID-19 cases. This is for the faster extraction and detection of cases. Meanwhile, according to the DOH, WHO will give 20,000 antigen test kits that will be used in the NCR Plus bubble, which are expected to arrive before the weekend. This is aside from the expected delivery of 30,000 antigen test kits that will arrive the soonest possible time. The DOH also clarifies they are not manipulating the COVID-19 statistics of the country. This after some lawmakers said yesterday that there is an underreporting of COVID-19 daily tally.
Bakit natin i-manipulate? What would be the objective, no? Ang gusto nating ipakita sa mga tao ay yung totoong nangyayari sa ground para magtulong-tulong tayo para mapatigil natin ito. DOH has always been transparent. The accuracy, the integrity of our data, you can check it. It's being validated every day.
Meanwhile, to the congested hospitals that are now in full capacity, 3 mega quarantine facilities reopen. This is where patients who can be separated from those with severe COVID-19 infection and in critical condition are brought.
Naandyan po yung Rizal Memorial Coliseum, naandyan po yung Ninoy Aquino Stadium, naandyan po yung Quezon Institute. Lahat po ito nire-reactivate natin.
It was on second week of March when Rizal Memorial Stadium with 97 beds reopened. Ninoy Stadium with 97 beds has just reopened. And on Monday, Quezon Institute with 112 beds will reopen. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
A team of scientists from Singapore has developed a diagnostic test that can detect the virus that causes COVID-19 even after it has gone through mutations. Queenie Rivera will tell us why live. Queenie?
Variant nucleotide card or Vanguard test is able to detect the presence of virus even after it has gone through the variation which has already been seen with the existing COVID-19 variants originated from United Kingdom, South Africa, and Brazil. Vanguard uses a gene editing tool known as CRISPR, or clustered regularly interspaced short palindromic repeats. It produces results within 30 minutes and can be used directly on patient samples. through a reaction mix that contains a specific enzyme which acts like a molecular scissors. It cuts off specific sites of the viral gene. If the molecule glows when cut, it means it carries the virus. Professor Tan Meng Ho from NTU School of Chemical and Biomedical Engineering said that it yields results 10 times more than accurate than the antigen rapid test or ART. This is the existing rapid test being used in Singapore. NTU Singapore scientists has started the research since August 2020 and working with a local hospital to collect clinical samples to further the research. The team is hoping to produce a more refined test kit that can identify a specific variant or a virus and not just detect the presence of the variation strains in general. Kat?
Thank you, Queen Rivera, reporting live from Singapore.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Philippine Health Insurance Corporation, or PhilHealth, admitted the delays in settling unpaid claims in several hospitals, which prompted some hospitals to reduce manpower amid the surge of COVID-19 patients. Joanano tells us why.
As the Philippine Health Insurance Corporation implements limited workforce in compliance with the national government's order and as they enforce lockdown on their central office after several employees were tested positive of COVID-19, PhilHealth Chief Attorney Dante Geran admitted the agency's slow processing of payment for unpaid claims to several private and public hospitals. These claims were already being used by the patients for their hospitalization. Attorney Geran explains that the delays on the processing of payment for claims was because of their limited workforce brought by the COVID-19 pandemic.
Kasi itong mga utang na ito kasi matagal na yung iba, no? Dinatnan natin dito. Yung utang na matagal mabayaran, hindi naman matagal mabagal, I would say mabagal dahil may rason, like itong COVID ngayon, ito gas-gas na rason ito. Pero talagang rason yan. Sa madaling sabi, talagang nag-reduce kami ng workforce namin. Kaya medyo mabagal talaga ang trabaho.
The PhilHealth chief explains that out of the 107 billion peso claims last year, the agency was able to settle 85% of it, while the remaining 25% was either returned to hospitals due to lack of documents, while some are under the process of evaluation. This figure was apart from the 800 million peso debt to Philippine Red Cross for the payment of swab testing being rendered to returning overseas Filipino workers and other sectors that PhilHealth is paying for. Attorney Geran further explains that there are times that they have to manually encode the details of the claims, and this is one of the cause of delays.
May mga claims talaga na may problema. Yung mga claims na may problema like yung mga alanganin ng mga nagsusulat ng application nila para pag-testing and then nagkamali-mali yung ibang entrada, ay talagang mahirap yan kakainin ng makina. So ang ginagawa ng mga tao natin dito ay mano-mano po ang pag-process. Kaya mabagal po.
PhilHealth assures that they are in constant coordination with their partner hospitals and vows to pay the remaining unsettled claims at the soonest possible time.
We admit, we accept that we have obligations, we have liabilities, and it's all of them are being processed.
Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health clarified that a PhilHealth ID is not required to get vaccinated. Nonetheless, vaccinees with no PhilHealth number were still advised to register for one at the vaccination sites for their own benefit. Marvin Calas reports why.
Vaccinees will still be vaccinated even without a Philippine Health Insurance Corporation or PhilHealth ID, as clarified by the DOH, following a statement from the Philippine Health Insurance Corporation that says otherwise.
Hindi porke wala kayong PIN ay hindi na kayo pwede bakunahan. Lahat po ng ating kababayan ay hinihikayat na magpabakuna. Huwag ho niyong problemahin na wala kayong PhilHealth number.
The DOH informed that a PhilHealth ID can be enrolled and registered at the vaccination sites.
Gusto ko lang hong klaruhin na ang PhilHealth at saka DOH nagtatrabaho po kami together. Siguro po ito pong sinasabi ng PhilHealth hindi lang po na ipaliwanag ng mas maayos. Unang-una, hindi po batayan ang PhilHealth number para kayo ay magpabakuna. Kung wala kayong PhilHealth number, go to the vaccination site. We will have on-site registration booths coming from PhilHealth so that they can easily register these people na wala pong PIN ng PhilHealth.
PhilHealth explained that although not a requirement, there's still a need for a vaccinee to have their own ID in order to be registered at the government's list that also serves as a proof of vaccination.
It works both ways, no? Unang-una, kailangan na magparehistro ka, magpalista ka. So pag nagpalista ka, babakunahan ka ngayon, katulad ngayon, babakunahan ka. So pabalikin ka after several weeks, no? So kailangan ng gobyerno na may listahan, may pangalan, yung sabi ko, and then ang sa parte naman ng yung babakunahan, ay pagbalik niya, sigurado na siya yun ang babakunahan. Maya kung iba-ibang nabakuna sa iyo. Kaya sabi ko, it works both ways. Sa listahan po, sa record ng gobyerno, at para din sa mga magpabakuna.
DOH added that individuals having no PhilHealth ID are not covered with health benefits in case of having an adverse effects following immunization or AEFI. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Manila city government continues its vaccination program for its residents. And today, persons with comorbidities in 6 districts received the jabs. JP Nunez reports.
The Manila city government designated 12 schools in 6 districts as vaccination hubs for its residents. Today, the City Health Office inoculated approximately 10,000 persons with comorbidities, which is part of the A3 category in the priority list of the government. All of them received the first dose of CoronaVac vaccine. According to some vaccine recipients, it was essential for them to get the vaccine, especially that COVID-19 cases in the country is rising.
For me, it's very important because it significantly decreases the chances of getting COVID. No, even though, for example, si Sinovac is only 60 or 70%, it's still better than 0% eh. Kaya mas maganda pa rin magkaroon ng bakuna.
Kasi po may ako epilepsy. Tapos nagkaroon po ako ng TB meningitis. Kinuhanan po ako ng tubig sa nagkatubig po yung utak ko. Yung na-stroke po ako.
The government has identified comorbidities that will included in the priority list. These comorbidities are chronic respiratory disease, hypertension, cardiovascular disease, chronic kidney disease, malignancy, diabetes, mellitus, and obesity. Meanwhile, the city government of Manila continues its call to its residents to register online to their vaccination program. They just need to visit www.manilacovid19vaccine.ph to get registered and print their QR code from the website as part of the requirement for the vaccination. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
Presidential Advisor on Entrepreneurship Joey Concepcion asks vaccine czar Carlito Galvez Jr. to give half of the donated AstraZeneca vaccines to micro, small, and medium enterprises, particularly in Metro Manila. Nel Maribohok will tell us why.
The Federation of Filipino-Chinese Chambers of Commerce welcomes President Rodrigo Duterte's directives allowing private sectors to import vaccines at will. According to the Federation's President Henry Lim, securing COVID-19 vaccines to pharmaceutical firms is still a big challenge given the supply and demand factors.
Right now, it's not only the tripartite, it's whether if you can secure vaccines also. It's more difficult to secure vaccine.
In connection with this, Presidential Advisor on Entrepreneurship Joey Concepcion asked vaccine czar Carlito Galvez Jr. to give the micro, small, and medium enterprises in the National Capital Region free COVID-19 vaccines. The free vaccines will come from AstraZeneca. The vaccine maker requires private companies to donate half of their vaccine orders to the government.
Now, in our discussions with Secretary Galvez the other day, he mentioned that we can direct our donation to national government to a particular sector, a particular area. So we told him, and we wrote him a letter, that we would like to focus this donation, the 50%, to NCR, which is the epicenter of this whole pandemic. And second, if we can focus this also to our micro and small entrepreneurs.
Based on the data of the Department of Trade and Industry, the bulk of MSMEs are from the NCR with more than 200,000 establishments in 2019. Many of them are affected by the impact of the coronavirus pandemic. The national government, together with the local government units and private sector, has already signed a tripartite deal to secure 17 million doses of AstraZeneca's COVID-19 vaccines. This includes 2.6 million secured by the private sector in November 2020, half of which would be donated to the government. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
Malacanang reiterates that food delivery should remain unhampered 24/7 during the implementation of the enhanced community quarantine in NCR plus bubble. The palace released the statements after a video of a delivery rider who was prohibited from delivering lugaw or rice porridge to a customer in a barangay in Bulacan province became viral. In the viral video, a village official told the food delivery rider that he could not be allowed to deliver the order because lugaw was not part of essential goods.
Essential po ba si lugaw? Hindi. Kasi mabubuhay ang tao na walang lugaw. Ang essential, tubig, gatas, groceries.
Pagkain po yun, ma'am.
Hindi nga. Hindi po essential si lugaw. Mabubuhay tayo ng walang lugaw sa maghapon.
But in a statement, presidential spokesperson Harry Roque said, lugaw or any food item is essential good, so delivery of this should not be hampered. Grab also posted on its official Facebook page a photo showing lugaw with the words, if food is essential and lugaw is food, therefore lugaw is essential. In a bid to make registration safer and easier amid the rising number of COVID-19 cases, the Philippine Statistics Authority is set to launch its online portal for the national ID system next month. Harleen Delgado has the report.
The Philippine Statistics Authority is in final stages for the launching of its online portal for the Philippine Identification System, or PhilSys. According to the PhilSys Registry Office, this will make the national ID registration safer and easier. Currently, PSA personnel go house to house and registering low-income households in the country. The PSA aims to register 40 million Filipinos online.
Ang issue kasi ng mga tao sa portal, safe pa yung data namin kapag nag-input kami. So we want to make sure that it goes through a final security audit at nakakasigurado kami na wala kami magiging problema later on.
The PSA records over 27 million Filipinos who are done with the Step 1 registration. Step 1 is where the basic demographic information of registrants are gathered. This is also where the scheduled appointments are made for the Step 2 of the registration, which is the capturing of biometrics. While in Step 3, the PSA will give the unique and permanent PhilSys number, or PSN, and the physical ID itself. Deputy National Statistician Assistant Secretary Rosalinda Bautista says they are proposing to extend the conduct of house-to-house registration until April 15, as requested by some local government units. The Step 2 of registration, or the capturing of biometrics, is also ongoing in low-risk areas in 32 provinces, noting that all registration centers are observing strict health protocols.
Pag nagtuloy-tuloy at maganda naman yung online portal, pwede na namin itigil yung taga-house to house. But of course, the house to house will also be done in areas na, kunyari, yung puro IPs. Yung talagang wala ba? Maaaring may connectivity sila pero wala naman silang gadgets o hindi sila marunong. So we still have to cover them.
With the pandemic affecting their targets, the PSA is still optimistic to achieve 50 to 70 million registrants this year. Jorlin Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
The NLEX Corporation and bus terminals record a decline in the number of commuters for the long holiday this year. Asher Kadapan Jr. tells us why live. The Chinese vessels first spotted in Julian Felipe Reef are now dispersed to other areas in the West Philippine Sea. The National Task Force for the West Philippine Sea, or NTF-WPS, confirmed that at least 44 Chinese vessels remain moored, anchored, and stationary at Julian Felipe Reef as of March 29. While the number of ships in Julian Felipe Reef decreased, the remaining part of the Chinese fleet has scattered in other features in the Kalayaan Island group, which is under the jurisdiction of Palawan. It added that the Chinese ships may be doing illicit activities at night and may cause irreparable damage to the marine environment in the area. The Armed Forces of the Philippines have since conducted 3 rounds of routine aerial and maritime sovereignty patrol missions in the area. The task force reiterated the government's call for China to pull out its vessels.
The White House announces new measures in response to acts of violence and discrimination that Asian American and Pacific Islander communities in the U.S. have faced increasingly over the past year. Marvy Dauphin will give us the details live. Marvy?
Kath, the Biden administration on Tuesday announced additional steps to advance equity, safety, inclusion, and belonging for all Asian Americans, including Native Hawaiian and Pacific Islander communities, through a whole-of-government approach. This comes as President Joe Biden faced more pressure from Asian American members of the U.S. Congress and activist groups to take stronger action after the shootings at Atlanta area spas and a Colorado supermarket just 2 weeks ago. A Justice Department cross-agency initiative will be established to enforce hate crime laws and promote accurate reporting of hate crime statistics. This builds on Biden's January memorandum condemning and combating racism, xenophobia, and intolerance against Asian Americans and Pacific Islanders in the United States, issued in his first week in office. The Department of Health and Human Services is allocating $49.5 million from the American Rescue Plan, or the COVID-19 stimulus package, to a new grant program for community-based, culturally specific services for survivors of domestic violence and sexual assault who face language access barriers, while the National Science Foundation will spend $33 million to study racial bias and xenophobia. In his first primetime speech this month, Biden has spoken out against the increase in violence that Asian Americans have been harassed, blamed, and scapegoated. And in his latest Twitter post, the U.S. president said that this was wrong, it's un-American, and it must stop. Kath?
Thank you, Marvy Dauphin, for that report. The world leaders have come together in the midst of escalating tensions over vaccine supplies to urge for a global treaty for pandemic response. Abel Ciliano reports why.
Leaders including UK Prime Minister Boris Johnson, French President Emmanuel Macron, and German Chancellor Angela Merkel are warning that a future pandemic is inevitable. Therefore, they are calling for a global treaty similar to the settlement formed in 1945 after the Second World War. In a joint article, the 24 world leaders, along with the head of the World Health Organization, Tedros Adhanom Ghebreyesus, aims to bring countries together and to dispel the temptations of isolationism and nationalism, among others. They further state that mutual accountability and shared responsibility, transparency, and cooperation within the international system can be achieved through a treaty on pandemics. The call followed after concerns around China withholding information from international health inspectors during investigations of the origins of COVID-19. Boris Johnson, who is currently the president of G7, a group consisting of the world's leading industrial nations, has urged richer nations to give surplus vaccines supplies to the COVAX systems to be distributed to poorer countries. The G7 is also moving forward in offering financial support for developing nations economically hit hard by the pandemic. Abel Ciliano, UNTV News and Rescue, we serve the people, we give glory to God.
Marine scientists say the ocean could be the source of treatment for some of the world's worst diseases, including COVID-19. Paul Gatchalian tells us why.
Scientists are now looking at the medical potential in the ocean to cure the world's most stubborn diseases. One of those group of scientists is C4Us, a biotechnology company which specializes in the discovery and development of new drugs based on novel marine compounds. The group is now working on a non-opioid analgesic, a safe and effective remedy for chronic pain. At a depth of around 20 meters, a variety of marine fauna covers the rocky cliffs. Scientists look there for patterns that could indicate defensive venoms that sponges produce to protect themselves from their neighbors. Scientists collect the samples and processes it for several months or even up to a few years of work. So far, the group say they have found two molecules that reduce pain activity in spinal ganglion neurons. They plan to provide them to the pharmaceutical industry for the next stage, medicine development.
This drug or this compound hopefully will be better than the rest of the drugs that we have in the market, for instance the opioids, because by acting in specific targets away from the brain, we rule out, hopefully, any kind of addiction problems.
Meanwhile, the Horizon Europe, an EU program that funds scientific projects in all the member states, is currently prioritizing marine research and healthy oceans, as the ocean could hold cures for some of the world's threats to public health: viral outbreaks, antibiotic resistance, and cancer. With marine biotechnology extending its reach way beyond just healthcare and pharmaceuticals, the blue biotechnology sector is expected to grow around 10 billion euros at the end of the decade in Europe alone. Paul Gatchalian, UNTV News and Rescue, we serve the people, we give glory to God.
SpaceX launched its fourth prototype rocket to Mars, which exploded just like the three rockets before it. Early Briones will tell us the details live. Yes, Early.
Herline, SpaceX fails another landing on Tuesday with its experimental Starship in preparation for its mission to Mars. The fourth prototype rocket, also known as Starship Rocket SN11, is said to have exploded before even reaching the landing site. SpaceX engineer Jan Insprocker, who commentated the webcasted test launch, stated that the rocket had a steady ascent, but just 6 minutes into its flight and moments just before landing, camera signals crashed due to heavy fog. Independent video streamers were unable to document the last stretch before the flight because of the said fog. But other footages, including that of NASA Space Flight Media site, showed debris falling down along with several audible explosions. Insprocker commented that the launch was another exciting test, even though SN11 ended up in bits and pieces, just like its three predecessors. Founder of SpaceX, Elon Musk, brushes off the failed landing and even tweeted that at least the crater was in the right place. Musk stated that something significant must have happened within the firing engines as it prepared for landing, but he is hopeful to figure out exactly what it was after investigating on site. This launch makes the fourth failed landing of all SpaceX rockets, but Musk already has a newer version of the Starship with hundreds of design changes on its way that should reportedly overcome these issues. SpaceX SpaceX has the vision of one day launching the Starship, which is the actual spaceship that will apparently carry humans to colonize Mars. Harleen?
Thank you, Early Briones, for that live report. Japan's famous cherry blossoms have reached full bloom earlier this year than at any time since formal records began. Charisse Dombowen will tell us why.
With more than 1,200 years since the start of recording of its occurrence, this year's cherry blossoms reached its peak the earliest in Japan. The peak bloom of the nation's favorite flower, which is also called sakura, had been relatively consistent for about 1,000 years, which happens during the month of April. But since about 1800, the peak blossom date in its former capital Kyoto has been gradually moving from mid-April to the start of the month, and with this year's earliest recorded on March 26. Cherry trees are sensitive to temperature changes, and the timing of their blooming can provide valuable data for research on climate change. Sakura's early blooming may most likely be caused by the impact of global warming, according to Shunji Anbe, an official at the Observations Division of the Japan Meteorological Agency. The agency's data showed that the average temperature in Kyoto for the month of March reached 10.6 degrees Celsius in 2020, from 8.6 degrees Celsius in 1953. The cherry blossoms bloom for about 2 weeks only, but their appearance is very much important to their country, both economically and culturally. Charisse Longbowen, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, March 31, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I am Kat Maraos, reporting live from Bangkok, Thailand, and sitting in for Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.